Conduit selection in coronary artery bypass grafting remains a critical factor in determining long-term graft patency, patient survival, and the need for repeat revascularization. The choice involves balancing the superior durability of arterial grafts against technical demands and patient-specific risk factors. The left internal mammary artery remains the undisputed gold standard conduit universally recommended for bypassing the left anterior descending coronary artery. Advantages of Lima graft include unmatched patency. Long-term patency rate exceed 90 to 95% at 10 to 15 years. Endothelial function. The Lima endothelium secretes high levels of nitric oxide and prostacyclin, rendering it actively resistant to atherosclerosis, intimal hyperplasia, and thrombosis. Autoregulation. Lima actively adapts its luminal diameter to the myocardial demand of the target territory. In situ graft retains its native proximal connection to the subclavian artery, avoiding ascending aorta manipulation, reducing stroke risk. Still, there are a few disadvantages. Limited reach, primarily restricted to the LAD and diagonal branches, rarely reaches lateral or inferior targets unless used as a free graft, which diminishes some hemodynamic benefits. Flow competition, highly sensitive to competitive flow. If the native LAD has a non-critical stenosis less than 70%, Lima flow can be compromised, leading to the string sign. Right internal mammary artery utilized primarily to achieve bilateral internal mammary artery grafting, often directed to the circumflex or right coronary systems. Advantages of the right internal mammary artery graft include survival benefit. Bilateral internal mammary artery grafting is associated with improved long-term survival and greater freedom from reintervention compared to single internal mammary artery approaches. Biological equivalence shares the same endothelial advantages and resistance to atherosclerosis as the left internal mammary artery. Here are some of the disadvantages. Sternal wound complications. The most significant drawback is a markedly increased risk of deep sternal wound infections, particularly in patients with diabetes, obesity, COPD, or advanced stage. Skeletonized harvesting mitigates